Hi, this is Ken Rude, one of the IU Emergency Medicine faculty and a member of the Ultrasound Division. The objectives for this talk are to review some basic fundamental properties of sound, to discuss some sound and soft tissue interactions. We'll briefly cover some concepts of color Doppler imaging. We'll look at some of the more commonly used transducer types, and then we'll discuss some commonly seen artifacts with ultrasound imaging. You'll recall that sound carries energy, no matter, and it's a longitudinal wave of compressions and rarefactions. That's a high pressure and low pressure energy areas. It does require a media to be transmitted, and sound is not transmissible in a vacuum. Frequency of sound is measured in hertz, which are how many cycles per second. We humans hear at the audible sound range from 20 hertz to 20,000 hertz. Diagnostic ultrasound, on the other hand, is way above our audible hearing and is in the range of 2 megahertz to 20 megahertz. Recall that a megahertz is equal to 1 million hertz. Propagation speed refers to how fast sound actually moves through a particular media. Air has the slowest propagation speed of around 330 meters per second. We're interested with diagnostic ultrasound in imaging soft tissues. Soft tissue has a propagation speed of 1,540 meters per second. As sound travels through various media, it loses energy, also known as attenuation. The farther it travels, the greater the attenuation. Attenuation is also dependent on the frequency of the sound. Higher frequency signals have greater attenuation, which limits their maximum useful depth of imaging. As sound energy is transmitted through the tissues, some of the energy is dissipated through various mechanisms. Most energy is lost to absorption and is converted to heat within the tissues. Sound is also lost by reflection and scatter, thus reducing the amount of signal returned to the ultrasound transducer and available for imaging. In the next few slides, we're going to be talking about transducers. Simply put, a transducer is something that converts one form of energy to another. Piezoelectric property implies that a substance creates a pressure wave when an electrical current is applied to it, and conversely generates a current when a pressure wave is applied. Quartz and tourmaline are two naturally occurring substances that have piezoelectric properties. Synthetic crystals are now used with ultrasound imaging, and the most common is the lead zirconate titanate, or also known as PZT. This is a diagram of a transducer with its specific zones. The structures in the focal zone will have the best axial resolution. The near and far zones that are depicted here are also known as the Fresnel and Fraunhofer zones. When you begin imaging, a couple of things to always keep in mind are depth and gain to optimize your image for best interpretation. The structure of primary interest should be set in the middle of the screen, and this is done by adjusting the depth until that structure is in that area. This is the primary focal point as adjusted by the machine automatically. This is the area where you can get the best axial resolution of the individual structures. Gain should be adjusted to give a nice overall grayscale, not too bright or not too dark. Too little gain gives a very dark image, and thus you're unable to really see structures clearly, whereas too much gain washes out the image and gives it a very bright white appearance. Both can obscure image detail, resulting in problems with interpretation. Most machines have some sort of optimize button in which the computer will automatically adjust the gain for best imaging on the overall screen. Properties of the transducer elements are important in resolution with imaging. Thinner elements have higher frequency wavelengths and thus give higher resolution. That is, they have shorter spatial pulse length and better axial resolution. The trade-off is greater attenuation, which limits the effective depth of imaging. Conversely, when you have thicker elements with lower frequencies, they have less resolution, but they have improved imaging at greater depths in the tissues. Probably the three most commonly used ultrasound transducer types are the phased array, curvilinear, and the linear. There are other types for more specific applications, but we will not be reviewing them here. Phased array probe is otherwise known as a cardiac probe, and this is often the go-to probe for many in the emergency department. This has a small footprint which allows for good viewing of the heart structures between the rib interspaces. It gives a fan or sector-shaped image. The picture on the right shows the typical phased array probe with its small transducer footprint. The image on the left shows the fan or sector-shaped image of a heart structure through the rib interspaces. The broad curved transducer of the curvilinear probe gives a natural fan or sector image. This is typically referred to as the abdominal probe, as it's primarily used in imaging deep structures in the abdomen. The lower frequency allows good imaging at increased depths required for abdominal structures. This picture shows a typical curvilinear or abdominal probe. You can see it has a large curved interface, which gives its natural sector image. The picture on the left is of a fetus, showing some nice imaging at increased depth. The linear probes have a flat face, which gives you a square or rectangular image the same width as the transducer face. These high-frequency probes have excellent imaging at shallow depths and are used primarily for imaging superficial structures and vascular structures, as well as for procedures. In the picture on the right is a typical linear probe with its flat face, which would provide the square or rectangular image that you would see on the left. This is an ocular ultrasound, and you can see that there is very, very high resolution of these superficial structures. The overall depth of this image is only 4 centimeters. Let's move on now and talk about some ultrasound artifacts. There's many types of artifacts that occur with sound interactions in soft tissues. Some of the artifacts are detrimental to imaging, but others are useful. Understanding what's causing the artifacts and how to work around them can improve your interpretation of ultrasound imaging. Posterior enhancement or posterior acoustic enhancement is an area of increased brightness due to sound traveling through a low attenuating structure, which is commonly a fluid or liquid-filled structure. Sound travels through a liquid-filled structure, there's much less acoustic attenuation of the signal. So this causes the structures deep to the fluid-filled structure to appear much brighter. This is useful in certain situations, such as when you're trying to image a fetus behind the bladder. Bladder is used as an acoustic window. However, this can also be detrimental when you're looking posterior to the bladder, trying to find small amounts of free fluid, say in a trauma case, performing a FAST exam. This ultrasound image of a bladder shows the typical bright area behind the bladder, which is the posterior acoustic enhancement. If that is your actual area of interest in this image, you would have to reduce the gain to get a better grayscale of that area rather than just the bright whiteout. Shadowing artifacts are caused by very dense structures such as calculi, which both reflect and then absorb sound. This causes complete loss of imaging distal to the dense structure. This is represented just as a black shadow. This can be useful to identify things such as gallstones and renal calculi as well as foreign bodies, but it can also obscure structures if what you're interested in is in that shadowed area. In this gallbladder image, you'll see some brightly reflecting gallstones and then shadows posterior to the stones. This seems to change as the ultrasound probe is swept back and forth across the gallbladder. Edge shadowing is caused by refraction of the sound beam off of a reflective curved surface, which results in a dark streak distal to that structure. When the sound beam strikes that curved surface, it's refracted and scattered, and thus no signal actually returns to the probe, and this results in a dark streak. This is commonly seen with round fluid-filled structures such as gallbladder and vascular structures, the eyes, etc. Moving the probe to a slightly different angle of incidence on that structure will allow visualization in those dark streaky areas. In this gallbladder image, you can see the dark streak off the lateral aspect of the gallbladder wall resulting from the edge shadowing effect. The last few slides discuss bioeffects. Overall, diagnostic ultrasound is very safe. However, remember that some ultrasound energy is converted to heat within the tissues through the process of attenuation. This is the reason we don't use Doppler to look at fetal heart rates as well as embryonic tissues, as they are in a very delicate developmental period. We refer to the ALARA principle, which stands for as low as reasonably achievable, regarding ultrasound energy and actual time of imaging. And a couple of last comments on bioeffects. Remember that transducers are waterproof up to the cord and thus can be used with gel and with a process known as water baths. However, any significant cracks in a transducer housing or submerging them below the cord can potentially cause a shock hazard. And always clean your transducers with the appropriate wipes, preferably before and certainly after each use. Check your cords and gel bottles and the machine keyboard, etc., which are often overlooked as these will sometimes end up with body fluids on them as well. Here's a few references for those of you who didn't get enough physics in this brief talk. Please feel free to contact me if you have any other questions regarding ultrasound physics. Thanks a lot.